Hey there, and welcome to Dr.G Pediatrics. In today's video, I'm going to tackle 5 common reasons why parents think their child may need antibiotics, but they really don't. And at the end, I will go over a few reasons where antibiotics may be indicated for your child. So stay tuned for Dr. G, my child needs antibiotics because I will review the common reasons why parents tell me that they feel that their child needs antibiotics, and then I'm going to kind of dispel those reasons as to why their child most likely does not need antibiotics. Feel free, parents, to insert yourself in this equation because it will probably help your physician as well, because this is not just catered to children, because a lot of times parents will say they need antibiotics for these same reasons. Okay, so reason number 1, my child needs antibiotics because they have an upper respiratory infection. That sounds scary. I agree. Upper respiratory infection sounds a little bit worrisome, a little bit scary, but it's not necessarily an indication for antibiotics. Because, to bring you in on a little secret, upper respiratory infection is just a fancy medical term for, a lot of the times, a common cold virus. I know. It sounds scary. And when we say upper respiratory infection, that means that the symptoms and the infection, wherever the infection is happening, it's coming from up here, okay? So it's not involving the lungs, which would be considered a lower respiratory infection. Upper respiratory infection is going to include the throat and the nasal cavity and the mouth. Lower respiratory infection, usually like a bronchitis or a pneumonia. So upper respiratory infection sounds scary, may sound serious, may not necessarily be the case. It could be a common cold virus such as rhinovirus that's causing the upper respiratory infection in your child. So therefore it is not an indication for antibiotics just because they have an upper respiratory infection. That was number 1. Number 2, my child needs antibiotics because they have a fever. Again, not a reason for antibiotics. And a fever, like I've mentioned in another video, is not necessarily a bad thing. A fever is your body's immune response to fight infection. That infection is not just due to bacteria germs. Viral germs can definitely cause your child to have a fever, especially in your younger children. So in that infant, toddler, lower school age children, something like a common cold virus can definitely trigger fever for them. That is not an indication that they need antibiotics, because if it's a virus, the antibiotics will not do anything to treat the infection. Viruses laugh at antibiotics. It does not help at all. So we don't want to give an antibiotic just because a fever is present. Okay. Number 3. My kid needs antibiotics because their snot is green. It's lime green, Dr. G. They need antibiotics. Okay. Again, that's also not a reason to give antibiotics just because of the color of the nasal discharge. It is the normal course for a virus is kind of when the virus first infects the nose, which is a common point of entry from a lot of common cold viruses. It enters through the nose, and then the inflammation or the infection of the virus creates this very clear, runny nasal discharge or fluid from the nose. right? That's what we see at the beginning. Well, once your immune system, or once your child's immune system starts really working and doing what it should do with the different fighter blood cells, the white blood cells, and all of that, then normally around day 3 to day 4, the mucus is going to change from that clear, watery discharge, which is usually from the infection of the virus, to that yellow, green, white nasal discharge, because it's your body's response to fighting the infection. So that is actually a normal, natural process that we would want to see. So the color changing from clear to yellowy green on around day 3 to day 4 of symptoms for your child is not an indication that your child needs antibiotics, because that can happen with many viral upper respiratory infections, which we've already discussed is just a very fancy term for a common cold virus. So, color of the snot is not. Ooh, that rhymed. The color of the snot is not. The color of the snot is not an indication for antibiotics. Okay, that was number 3. Number 4, Dr. G, my child needs antibiotics because I need something to just knock it out. Just go ahead and just knock it out. I understand. I understand being a parent to a child who is sick, and no one wants to see their child in pain, sick, under the weather. So I'm not making light of this because I am a mom myself, but the antibiotics, it's not going to knock anything out. It's not going to knock it out. There's not a quick fix. It's just, there's not a quick fix, and it's frustrating because you want something that's just going to make it better and make your child better as quickly as possible. So I understand that. But antibiotics is not going to be a magic pill. It's not going to help a virus. It's not going to do anything to the virus. It's not going to knock anything out. Okay? So please don't get mad at me when I tell you that I cannot give your child an antibiotic to knock it out. It just won't work. Additionally, this is just kind of a sidestep to this, is that sometimes parents get frustrated when they're using like an over-the-counter cough and cold medication to treat their child's symptoms, and they're like, it's not working. These medicines are not working. They still have a cough, they still have a runny nose, and they're still congested. And I know, I know, I've been there, because these medications are not a cure. They're not going to cure your child's symptoms. So yes, they may still cough even though they have a cough medicine. Yes, they may still have a runny nose and sneeze and have a sore throat, and they're taking this medication, because these medications are not cures. They're not cures. The virus is in the body. It's going to do what it does, and your body's immune system is going to fight that infection, and it's going to leave the body, and all will be well. And those symptoms are a byproduct of the virus in the body. So those medications, those cough and cold medications, are not there to cure it or like get rid of the symptoms. They're really just supposed to be a help, right? Anything that you can do to help decrease the severity of that congestion, to decrease the severity of that cough for your child, is the real reason why we recommend for age-appropriate children those medications. So they're not going to be magic either. Nothing is magic. It's unfortunate, but it's true. But the body is a beautiful and amazing thing, and the body is fighting that infection for your child and strengthening their immune system. Okay, that was my little segue. Okay. All right, and then another common reason, which is similar to the knock it out, number 5 is, Dr. G, my child needs antibiotics, my kid needs antibiotics because I don't want it getting into their chest and causing a pneumonia. And I hear it, and I understand it, and I empathize with it, But giving a child an antibiotic when it's a viral infection is, one, not going to prevent that virus from making its way down into the lungs and creating infection. And number two, it's not going to prevent, it's like not a preventative medication, if that makes sense. And then antibiotics are going to be specific for bacteria germs. So yes, an antibiotic is given when we have a child where we feel they have a bacterial pneumonia, and antibiotics will work to fight that infection. But it won't prevent a bacterial pneumonia if you give a child day 2 of symptoms and you throw antibiotics at them. It's not going to like be a prophylactic and prevent that pneumonia from forming. So it doesn't work like that, unfortunately. If that were the case, there would be, there would be a lot more antibiotic resistance, which is one of the main reasons why we as physicians try to minimize the need for or giving or prescribing antibiotics unless there really is a clear-cut indication for that. So antibiotics is not going to prevent or stop your child from developing a pneumonia, unfortunately. And I will also point out that in school-aged children, viral pneumonias are most common. So the virus makes its way, remember, from the upper respiratory infection down into the lungs and creates that lower respiratory infection, which is a pneumonia. Sometimes that happens with viruses, sometimes that does not, but most commonly it's a virus germ that's creating that infection or that pneumonia in the lungs, and it's not a bacteria germ. So it's stressful. I know you hear that cough, you hear that rattle in the chest, you're like, they need antibiotics. Most of the times that's not the case, because again, it's not going to do anything to a virus. The virus is going to laugh at it and continue doing what it's doing. Okay, so the top common reasons why I get from parents stating that their child needs antibiotics is because their child has an upper respiratory infection. We now know that's not the case, because a URI or upper respiratory infection a lot of times just means it's a cold or a head cold and it's involving the throat and up. So that's number one. Number two, my child needs antibiotics because they have a fever. We know fever does not mean bad. Viruses can cause fevers too. Antibiotics are not going to do anything for that. Number three, my child needs antibiotics because their snot is green. We know that's not the case now because the color of the nasal discharge changing from clear to yellowy green is a normal process during an infection. Number four, my child needs antibiotics because I need it to be knocked out. We know that is a well wish, but that is just not accurate, and antibiotics will not do that. And number five, my child needs antibiotics because I want to prevent it from getting into their chest and causing a pneumonia. Unfortunately, it does not work that way, and antibiotics would not help for that. So those are the common 5 reasons that I get from parents. We've gone through that, and remember, you can insert this for yourself as well for when you get sick as a parent or caregiver. So those were some of those reasons that we can now know. Those are not reasons for giving antibiotics. So you're probably thinking, okay, Dr. G, okay, you gave me all that information. When does my child need antibiotics? And this video is tailored more so towards those upper respiratory infection, common cold-like symptoms. So obviously there are indications for antibiotics in a lot of childhood or adolescent infections, but for this topic where we're tailored more towards kind of your cold symptoms, upper respiratory infection, when would an antibiotics, or when may an antibiotic be indicated? So one indication for antibiotics would be if your child's fever is present longer than 5 days. That can be a sign there may be something else going on. Most viruses will not give a fever, which is considered 100.4 or higher, for longer than 5 days. I will also put a note in there that influenza virus, aka the flu, is one of those viruses that can give fever for up to 7 days. So that is one of the viruses that we can see that. Nonetheless, if your child has fever for longer than 5 days, it is a great idea to have your child evaluated in person to see if there is an additional source of infection other than that virus. So, has their child developed a ear infection, a secondary infection, like an ear infection, a sinus infection, a pneumonia, like we discussed, that lower respiratory infection. So that may be an indication for antibiotics if that fever is present longer than 5 days, specifically though to find an additional source. So it's not the fever in itself that would warrant antibiotics, because we would definitely want to evaluate what the source is, right? We would never want to just start an antibiotic saying, you have fever for 5 days, let's go ahead and throw that antibiotic on it. It's not the best way to practice. And if that is what you get, I would just ask, okay, what are we treating? And just be able to get a very specific answer for that. Okay, so that may be an indication for antibiotics for a fever that's present longer than 5 days. Still, number 2, still kind of within that realm of fever, would be if your child had symptoms and a lot at the beginning of their symptoms had like a fever for 2 or 3 days. The fever went away. It's, they seem to be getting better, and then day 6 or day 7, they spike a fever again. That may be an indication for antibiotics and having them seen in person to get a good reevaluation, because they could have been seen on day 2 of symptoms and doctor said everything looks great. This is probably a virus, an upper respiratory infection. Continue doing supportive care at home, and you're like, okay, great, I'm in the clear. But if that child develops a fever after having no fever for a few days, then that could be a sign of, again, a secondary bacterial infection, which means the initial infection was viral, but then the bacteria germs came on board afterwards and then created a second infection. So like an ear infection or a sinus infection or a pneumonia. Those would be some of the more common ones that we can see. So number 2 would be if there's been a resolution of fever for longer than 24 hours and then a new fever returns, that would be an indication, or maybe an indication antibiotics are indicated. And then a third reason for whether an antibiotic may be indicated with managing, or if they have these symptoms, if the symptoms are kind of lasting longer than 14 days, where they are just not clearing, it's just continuing and persisting, and it's just worsening after 2 weeks, that may be an indication where an antibiotic is indicated, because sometimes with a bacterial sinus infection, that's what we'll see, this kind of persistence of worsening of the nasal discharge and the stuffiness and the cough for a child. So worsening after 2 weeks would definitely be a thought to say, okay, this seems to be lasting a little bit longer than a common cold virus would, and then maybe an indication for antibiotics. I'm not saying definitively, but maybe that time to get reevaluated and say, okay, is there something else going on, because they're just not clearing the infection. Okay, so 3 reasons where they may need antibiotics: if they have a fever for longer than 5 days, they have a break in the fever for longer than a day, and then a new fever returns, or if they have ongoing worsening symptoms after 14 days and they're just not getting better and they seem to be getting worse. Could all be indications that an antibiotics would be indicated for that. And so I just want to also note, when we think about not giving antibiotics, there's valid reasons for that. There are over 200 viruses that can cause a common cold in adults and children. Rhinovirus has over 100 different strains, okay? So there is just a lot more viruses that cause these symptoms than bacteria germs do. It's just more commonly viral. And so we don't want to prescribe antibiotics for the vast majority of these infections because that leads to antibiotic resistance. And what that means is you give amoxicillin every time they have a cold, the germs, the bacteria germs that kind of live in the body start figuring out ways to resist that antibiotic, and then they become strong. And then these antibiotics that usually would work to fight a true bacterial infection, they no longer work. Okay, and that is scary because those bacteria will continue to grow, and then there's just these large population of resistant bacteria germs that they're just laughed at a lot of these antibiotics that used to be very useful and beneficial. So that's a big reason to not give antibiotics in general. So we know viruses are usually the culprit for causing a lot of these. And adults on average usually get about 2 colds, common cold viruses a year, right? And then children who are in school usually get more. They usually get about 4 to 5 a year. So knowing that these are most likely going to be viral and not turning into something bacterial is more of an indication that we should work on letting the body does what it does, which is a wonderful thing, and that immune system working and building and fighting the infection, because the virus will eventually leave the body. It's just not going to hang out, and just chill and just say, I'm actually going to stay here. I like this host. It just doesn't work like that. It's eventually going to leave and it's going to do its thing. And then your body has memory of that virus. So they've built immunity to it. Now, because there's so many different strains of common cold virus, that doesn't mean you can't get the common cold virus again, because there's just so many strains. So I hope that you guys found this helpful. And so the next time you will not give your child's pediatrician a hard time. And then you also won't go to your doctor requesting antibiotics because you have green snot and it's been 3 days and the over-the-counter medications are not working. Okay. So if you found this video helpful and you think there are other people who need to receive this message, please share it. And if you found this beneficial, please subscribe. Until next time, have an awesome day. Bye.